Welcome everyone to this week's coaching call. We are going to be talking about some red light therapy topics today, but mostly we get a lot of questions before people come in to begin red light therapy. What do I need to do? Where? So today we're going to talk about what to do before a red light session and what to do after a red light session.
That's right.
So there's some things that will help maximize the experience both before and after, and kind of extend that period of benefits, especially afterwards.
Yes.
Yep. So you can set yourself up beforehand to do a much better job of experience all the healthy benefits afterwards.
That's right. So
Let's talk about that.
Let's talk about before. Let's talk about before coming in for a red light session. How should I prepare? There's a couple of things to do. First of all, you want the light emitting directly onto your skin. And that being said, since the light is going to be emitting directly on and then through the skin, you don't want to create any kind of a barrier between you and the light. So this means on the day of coming to have a red light session, you want to avoid using oils, argan oils, coconut oils. If you have a lot of oil in some of your lotions, I recommend avoiding that. If you're using the faceplate and you're really desiring to see, a reduction in fine lines and wrinkles, and then you want to make sure that you're getting as much absorption as possible for discoloration and scarring and things like that, you don't want to be wearing makeup. And you don't want to be wearing makeup, and you want to avoid having, again, put on maybe your face cream or your face oil ahead of time that day. Typically here we'll have makeup wipes for that reason specifically, but...
So let's say, so selfishly here, right, not wearing makeup. However, like I do have lotion or something on. If I'm doing the faceplate later, which this time of year I'm doing it a lot more frequently because the change in weather is like not doing well for me right now. Should I, even though I don't have makeup, should I still use a makeup wipe just to wipe my face off for a lotion?
If you've put lotion on, and your lotion most lotions, unless they say specifically oil free, right? Neutrogena has a line, so some people who are using red light therapy will actually use that line of oil free Neutrogena for the time being, so it's not something that they have to worry about while they're coming in. But that is a option for you. But yes, otherwise I recommend definitely making sure, again, that you've wiped that off and there's no barrier between you and the faceplate.
Interesting. Great.
Another couple things people ask, recommended, do you get better results waiting to eat 2 hours before? And the answer is actually yes. It's not always easy to time things that way, but because the liver is involved and you've got a lot of things, your lymphatic system is going to shunt itself into the liver, and the liver is what's responsible for packaging up all of those toxins and all of that garbage and sending it into the toilet. That waiting 2 hours before your red light actually is going to aid in that channel and portal being open for the emulsification and mobilization of fat at an accelerated rate. So waiting to eat 2 hours before and then 2 hours after, actually. So I know that's a little bit of an aftercare type of thing, but waiting that 2 hour window can be really helpful also.
Nice. And you mentioned the red light directly on the skin. So normally people are getting undressed to get their red light therapies done. I would say we're also doing a lot of 3D body scans right now, along with the appointments. So it would also be, recognizing, am I getting a scan done today, and either wearing really tight sports bra and workout clothes that are really tight.
Yes.
Or just planning to
Dress down. You can, so with red light, there's a couple of options. You can dress down completely depending on exactly where you want to be treated. I always recommend, again, it isn't, you are going to get what's beautiful is overall. This is not spot reduction, but in some part and partiality, you can definitely see significant changes in where those pads are being placed. Mm-hmm. You will get an all over, though, very congruent look into the body. So there's no kind of dysmorphic, type of, look to the body when, we're being treated with red light, which is a big advantage of red light.
Over cool sculpting.
Oh, right, because it is, it is very just this area or that area. So we're talking about, and we can talk about the hyperdysplasia that can sometimes happen with that type of a thing. So what's beautiful is we're not just spot reducing any one area, and we're not destroying tissue, which is important. We do not go apoptosis. We are not destroying the fat cell completely. People are giving the fat cells a bad rap. They're like, well, destroy it, kill it. Well, here's a couple reasons why you don't want to do that. Actually, your fat cells were designed to absorb toxic materials. Sorry for like the rabbit trail here. And we need them in order to keep us alive, right? Whenever we destroy the cell completely, what happens is that no matter what, if your body ever had an encounter where it needed to absorb toxic material back into those fat cells, the ones that are destroyed, it will not come back there. So say I got spot reduction and I got cool sculpting done in my abs or in my, my lower waist, right? I wanted something done there. Well, what happens is once those cells are destroyed, nothing can come back. However, if you are ever to experience, if you get sick, there's a lot of different environmental reasons. We absorb toxicity, all these things. What's going to happen is you are going to get the fat cells that are above it and below it to absorb that material. So pretty much you're going to get this indentation in your abs, and you've got stuff flowing over and flowing under and everywhere else except that spot, and that just doesn't, people are not happy when they come in here and they're discussing with me, hey, I did cool sculpting and this is what happened, and what we have to do is start to address the other tissue around it, which is possible. So I don't want you to, please, no shame here. Like if, people don't know that that's going to happen, and it is a small percentage of people, but it is actually,
we've seen a number of people that
have it, and we've been able to be very successful with those people using infrared light coming behind that and kind of working that all out.
Got it.
Yeah.
Okay, so before the session, we've talked about, lights directly on the skin. Mm-hmm. So plan on dressing down. We've talked about potentially, not trying to not eat 2 hours before the session.
That's right.
And either wiping off lotions or makeup right before the session, or changing what you're putting on or not putting on the day of a session. Okay. Anything else before a session?
You can start drinking water definitely that day. I notice when I use the lights, I automatically get more thirsty. It's almost like a call to action. My body is pretty in tune. And so when my body knows, ooh, like it's time to get rid of whatever is floating around, I get really thirsty. So sometimes making sure we're starting to stay hydrated beforehand is helpful. So it's not that overall like, oh my gosh, I'm so thirsty.
Yeah.
Yeah.
Great. Okay. And then we do our session for 20 minutes. Mm-hmm. And then we're doing the Vibe plate for 10, which is kind of getting that lymphatic drainage moving.
That's right.
And so how do we maximize after the session? Mm-hmm. What can or should we do afterwards to kind of get the most out of our sessions?
So it's important to know that your body is lymphatically draining for 72 hours after every time that you have a treatment. So staying conscious of, yes, the same way that you used the Viplate for lymphatic drainage. Some people will rebound, briskly walk. People ask me about the sauna, which I'll have a whole conversation. They ask me about lymphatic massage and things like that. All those things are really important. And also,
So rebound, what you're talking about is like the trampoline, jumping on a like
jumping.
a small trampoline.
Exactly.
Okay.
Jumping up and down, on a small trampoline, 15 to 20 minutes or so. Brisk walking, 15 to 20 minutes or so, really gets your body moving. Also, there was something else I wanted to say.
Lymphatic massage.
Yes.
I've seen people use like the little massage guns.
Yes.
On different areas.
Exactly. Dry brushing is another good tool. So just continuing, because you've got that 72-hour window. Again, the water, super important. It's 90 ounces every day for those 3 days. Make sure that you're drinking. So you're flushing. Another good...
Do we need to restrict eating afterwards? You said 2 hours afterwards.
I would wait best bet is to wait 2 hours afterwards, so your liver has time to actually do its job of all that cleanup. And then sometimes wearing compression garments at night is very helpful, actually. So wherever you have been treated, wearing compression garments is only going to help really maximize like all those cells and all that shrinking and all of that, garbage, triglycerides and toxins coming out of all of those cells, if you can stand
it. So do people need to do all of these things?
I would say definitely the watch the lotions and the oils and things like that. Are you going to get the very best results doing all those things? Yes, absolutely. You're going to get the best results doing all of those things, right? It's not hard to, it's getting colder out, but try to get out there for a walk. That'll maximize your benefits.
Okay, great. You were going to mention something about saunas.
I am going to mention something about saunas. People ask me, yes, are those? Is that a good way to lymphatically drain? I actually want to address two things. People ask me, one, if I am in an infrared sauna, isn't that the same as using red light therapy? So I want to address this because the answer is no. You are not getting the potency and the direct emission, and you're not getting the 3 low-level laser infrared. So you're not getting far and near, you're not getting all of that combined, and it's not directly being absorbed into the skin. Our technology in Dahlia is going to make sure that we're absorbing up to 8 to 12 millimeters deep through the skin to actually get to the mitochondria of the fat cell. And in infrared, you're getting some benefit as far as, some skin benefit, but you're not getting that
depth of
that or the potency of that, not near enough to get to the nucleus of those fat cells themselves.
Our red lights are powerful.
Yeah. Yes.
It's not a full... You're not getting that much power emitted in a sauna.
That's right.
It's more about heat than it is the red lights.
That's right. And then the second part of that is people say, well, if I sauna, can I maximize my benefit since we're, excreting all of that waste through urine, sweat, and bowel movement? Would it stand to reason? Absolutely, yes. It does work. My thought process is just make sure that your energy input and output actually aligns itself. So in other words, I notice with some people, you just need to eat well. You need to be making sure that you're eating well for that day. And I always ask people at least to take their protein up a couple ounces extra on the days that they're using the sauna. And the water is huge because you don't want,
And maybe even adding some electrolytes to your water.
Absolutely.
Before or during the sauna would be
important because that's a lot of work. Let's talk about the fact that it's a lot of work on your body, right? I know that we feel so great when we're using red light therapy that we're not thinking about all the, for lack of better words, behind the scenes work that your body is actually doing to really it's an amazing it's an inside job, right? So there's a lot of work to be had. So there's a lot of energy expenditure out. Same when you're using the sauna. It may feel great, and but you can feel
well, and that's what I was gonna kind of get to next is you've got red light, which is really exposing your body to a lot of toxins. Sauna is gonna kind of exacerbate that. And so if you're someone who has a lot of fat to lose,
right,
or has really done a poor job at eating well for a period of time, your body, it is not gonna feel good,
right,
for your body to have that many toxins floating around.
It's true.
I mean, be prepared to feel like you're under the weather.
Exactly.
Be prepared for your digestive system to like, what in the hell just happened here? Like,
yes.
Because it's not used to that much toxicity. Like, we're increasing the toxic load on the whole system. And so, we're talking about the liver, but it's not just the liver that's affected by increased toxins in the body.
No.
All the other systems are affected as well.
Yes.
And so, also being really conscious of, I just did a sauna session over the weekend, and for some reason, it hit me like a ton of bricks. I needed to take a nap that day. Like,
yes,
it just
exactly.
wiped me out.
Yes.
And so, being in a place to recognize that, listen to your body, and being able to respond to it, like, you need to be in a place where, sauna on top of red light is like next level.
It really is. Like take yourself in phases and recognize when it's just too much.
It's not something we're typically like promoting people to do.
But it is a question I get asked a lot, for sure. Yep. And I think
I would even play around with like the duration of sauna use. Right? So let's say you have you're lucky enough that you have a sauna at home and you want to, continue to use it or maximize it. Maybe it's 20 minutes instead of 30 or 60 minutes, right? Like, dose it appropriately with, the load that's on your system. Especially if you haven't done what we've already talked about, where you haven't done a good job at hydrating, you haven't taken any electrolytes, you haven't really watched your protein intake that day. Maybe don't make it a super long sauna session.
That's right.
Right? Like, sometimes it's not better to beat your body up.
That's right. It's not. Exactly. And that being said, I want to also, that's right, it's not a great idea to give your body more than it can handle in those cases when it's trying to move toxins through and out the body, because you can feel that.
Yeah, more is not always better.
More is not always better, so that's important. It's also why we take one day in between infrared sessions. We always say that we would rather not do back-to-back days for that reason, if we can at all handle, once your body gets in a really good rhythm of detoxification, and people tell me all the time, oh, I notice I'm sweating more now. I'm like, exactly, perfect, beautiful. That's exactly what we're looking for, right? We're looking for that, all organs of elimination to be, maximized. I also want to say that when you're starting to use it, if you're feeling bad, that's not necessarily a sign to stop, right? So if you are, and it's called a Herx reaction. It's called a Herxheimer's reaction. It's a detoxification reaction that says sometimes before things get better, they feel worse. Again, we want to prevent them from feeling too bad. And ask me about that, because I have binders and I have things available for people that can really help them through that initial detoxification. But what some people want to do is like, oh, this is horrible, bad, let me stop. And that's not necessarily, that's not necessarily the answer either, right? It's in dosing the
It's
time,
like doing a hard, heavy workout once a week.
Right.
Yes. You just get over the soreness and then you go do it again.
Right.
Right. It's like, if you could
That's right.
keep that momentum going, you're not going to be as sore the next time.
That's right. And hopefully
you build momentum.
Get benefits, right, out of that. Like you actually should feel more energized after exercise, not, dead in bed after exercise.
Yeah.
Yeah. So,
yeah. Interesting.
Yeah. So symptoms to look for, whether you're using our red light therapy, would be sometimes if you're very sensitive and in tune to your body, you will feel met. That's perfect. It does feel like something's coming on. Sometimes the things that you deal with in your body the most show themselves up. That's another thing that I've noticed. So like if there's something specific, a specific symptom that you're dealing with, that symptom will show itself up just a little bit worse. It doesn't mean that it's a no-go for you. It means that your body is working through its own detoxification processes. And just hang on. Where is the, usually it's a 4-day, right? I will say if you are not feeling better after 4 days, then let's have another conversation. But usually at that 5th day mark, we get that, okay, like I actually feel good.
Yeah. And also recognizing and communicating changes in bowels, right? Mm-hmm. Because as we're putting more toxins into the digestive system, and as you're losing fat, and that's going into the digestive system, your bowels are going to change.
They are.
They're going to change consistency, they're going to change colors, they're going to change all kinds of ways.
That's right.
Times and, frequencies, and, being prepared for that.
Yes.
It also shouldn't be constantly, where's the bathroom situation.
People ask me that all the time too. Oh my gosh, am I going to need to know exactly where the nearest bathroom is? Do I need to stay close to the bathroom?
This is not a cleanse where it's like, we're trying to,
thankfully.
Yeah, you're right. But recognizing that you're going to notice changes. And so when should someone reach out based on what they're noticing in that area?
As far as?
Like if somebody's getting really loose stools, if somebody's getting really constipated, at what point should they be like, okay, Angela, I'm seeing these changes? When
I asked for the first 4 days. If on that 5th day you're still experiencing those things, it's time to reach out. Let's talk about it. Typically somebody at that point, they either need a binder or there's something else going on, which is also beautiful because see, when we start to detoxify and offload and quiet a lot of the input of toxins in it, the body will reveal some of the underlying things it's been challenged with because it can finally hear itself start to talk. We can hear it start to speak.
Great. What else? Anything else we're missing? I feel like we've covered a lot of the before and afters.
I think so.
Yeah. Otherwise, I'm thinking afterwards, meal strategy is meal strategy. It's more of the timing.
Let's talk about that a little bit, right? So if we know like the whole system is working, but we do know that the liver is responsible for fat metabolization. It may stand to reason that we're pulling back off of for the short term of dietary fats, because that actually does make a big difference, right? Even the healthy ones, right? I mean, obviously, the fried foods, heavy laden hydrogenated oils, and we want to stay away from all those. But the healthy dietary fats like the avocados, nuts, seeds, oils, olives, things like that, for the time being will be helpful to pull back from.
I was just going to ask you also, so I have my gallbladder, but I don't, but my body just does not do well digesting fats.
Yes.
People also don't have gallbladders.
Right.
What do you feel about bile salts during this, like Colacol or other products that are just going to thin the bile and help your body digest those fats?
So helpful, especially if you don't have a gallbladder. Also, bile salts, where bile salts will work for someone, they'll aggravate someone else. So at the least, making sure that if you don't have a gallbladder, that you've got extra liver support, because your liver's taking on the brunt of what your gallbladder is no longer there to do, right? And then, bile salts. Some people, from the second they have their gallbladder out, do bile salts, and they're beautiful. Like, it's beautiful. So I highly recommend, trying that. But in the least, if you don't have a gallbladder, you need to make sure that we've got that extra liver support. So we've got that.
Perfect.
Lots of different
Great.
options for that.
And then, not just issues, but since we're kind of talking about some of this, like, also if you're hitting any kind of stall, or, we don't want to wait 4 days of you not losing before
That's
you
right.
reach out.
That's right.
It's 2 days.
It's three solid.
Okay, so 3 days of the scale not moving at all.
Or going up.
Right.
It's time to troubleshoot, right? Because sometimes it's completely normal, right? And everybody has their own rhythm, but sometimes people are hitting some other type of a snag, and we definitely need to dive a little bit deeper into figuring out what that was, so we can unhook it and you can continue to go.
Perfect. Great. Okay, so we talked about what to do before red light session. We talked about what to do after red light session to maximize all those benefits. If you have any questions or tips that you've been doing or trying, leave them in the comments below so everyone else can kind of take a look at those. And if you have any questions about how we can support you better before, during, or after your red light therapies, please reach out. We're happy to help. We'll see you next week, everyone.